Welcome to the Medication Administration Training for Head Start Early Head Start. This training video is to be watched annually, only after you have completed the in-person training. In order to ensure the safety of our children, Head Start has established policies and procedures to guide staff in the proper administration of medication at school. At Head Start and Early Head Start, we encourage the parents to administer medication when the child is at home. Only if the medication needs to be administered while the child is at school do we take on this responsibility. This decreases liability for the organization and you as the individual. According to Oregon law, medications are classified as either prescription or non-prescription and non-injectable. The exceptions are pre-measured doses of epinephrine, pre-measured doses of glucagon, and medication that is available for treating adrenal insufficiency. In Head Start, anything that goes in or on the body is considered medication. Head Start typically does not administer injections unless it is an EpiPen or insulin injection, which both requires in-person training. Prescription medication are any non-injectable drug, chemical compound, suspension, or preparation in suitable form for use as a curative or remedial substance. It's taken either internally or externally by the child, and under the written direction of a physician and written permission of the parent. Non-prescription medicine are commercially prepared non-alcohol-based medication that is necessary for the child to remain in school. Head Start does allow non-prescription medicine as long as there is a label, a letter from the doctor, and permission from the parents. Homemade remedies or medications, for example ointments or teas, are not allowed to be administered in Head Start. Physicians that can prescribe medications are doctor of medicine or osteopathy, physician assistant, nurse practitioner, dentist, optometrist, and a naturopathic physician. You will need to make sure that the prescription is from one of these professionals. Contact our nurse or pharmacy if you have any questions. When given a medication, make sure to read all of the information on the prescription label. Look for the name of the child, the doctor's name, the type of medication, the dosage, the date the medication was prescribed, and any side effects or storage requirements. It is also important to ask the parent about any side effects that they have seen while their child has been on the medication. Head Start and Early Head Start allows non-prescription medicine with a doctor's letter, the medication administration form, and the following criteria: name of child, directions for safe use, expiration date of medicine, list of active ingredients, name and address of manufacturer. Medicine must be in the original container, and it is preferred that the bottle or container has not been opened. When storing medication, store in a child-resistant safety container. Keep medication in a locked, cool, and dry place out of reach of children. Read label for storage instructions. Keep refrigerated medicine in a locked box in the refrigerator. The 5 rights should be reviewed each and every time you administer medication to a child. Write medication. Check that the name on the medication is the name of the child in front of you. Write child. Make sure that you have the correct child by verifying the name of the child. If needed, ask another staff member to help verify. Write time. Read the label to verify that the medication is being given at the correct time. Write dose. Read the prescription label and check again after you have measured and dispensed the medication. And write route. Reread the prescription label to make sure the medication is administered by the right route. Medication administration is a shared responsibility between the teacher and the family worker. Typically, the family worker fills out the permission form and communicates with the teacher about the child, their medication, and any side effects. If the family worker is not available, this responsibility falls to the teacher. When filling out the medication administration form, ask for specific instructions from the parent. Ask what side effects have or could occur, and send to health assistant, who will forward to the nurse for review. The first questions on the medication administration form ask the parent whether it is necessary that the medication is administered at school. If the parent says no, encourage the parent to administer the medication while the child is at home to empower the parents to take on this responsibility and decrease liability. The main medication routes that Head Start will be authorized to use is orally, topically, and through an inhaler. Exceptions are EpiPen or insulin injections. Head Start never gives medication rectally. If the child has a medication that requires this method and they are in need of assistance, call 911. Before giving medication that is considered as needed, call the parent to let them know the symptoms being displayed and why you think it is needed. Inform the parent or parents again when the child is picked up and by sending a note home. These extra steps to communicate will notify all family members and keep the child from becoming over-medicated. Each time you administer medication, it needs to be logged on the medication administration form. Insert the date, time, dosage, route, and your initials. Note any behavior that is a possible result of the medication. Remember to sign and initial the bottom of the form. The first step is to wash your hands. Next, retrieve medication from storage. Then assemble your supplies. Cotton swabs, medication, portion cup, tissues, and gloves. Now check the 5 rights. Right child, right medication, right time, right dose, and right route. Next, put on your gloves and put a small amount of medication in the portion cup. Assist the child in removing any bandages and cleanse the skin with tepid water. Pat dry, don't rub or scrub. Use a cotton swab to take the medication from the portion cup and apply sparingly to the appropriate area. Never dip swab back into the original container. If you need more, use another swab. Cover area if necessary to discourage picking or scratching. Thank the child for their assistance. To remove gloves, place all trash in one hand. Take the other hand and remove the glove by pulling it over the items. Then make sure the other hand is holding the glove with the trash and remove that glove by pulling it over. Throw in the trash. Record the medication that you gave on the medication administration log. Return the medication to storage. Wash your hands before you leave. First step in administering oral medication is to wash your hands. Next, assemble your supplies. Medication, portion cup, syringe, tissues, and gloves. Now check the 5 rights. Right child, right medication, right time, right dose, and right route. Next, put on gloves. Next, Draw up the right amount of medication into the syringe or medicine cup. If the child prefers to use a cup, use the syringe to measure the medication and dispense it into the cup to give to the child. Encourage the child to help hold the syringe or cup. Offer the child water to wash the medication down. Wash the syringe with hot soapy water, rinse, shake, or towel dry. To remove gloves, place all trash in one hand. Take the other hand and remove the glove by pulling it over the items. Then make sure the other hand is holding the glove with the trash and remove that glove by pulling it over. Throw in the trash. Record the medication that you gave on the medication administration log. Return the medication to the Ziploc bag into storage. Wash your hands before you leave. The first step in administering eye medication is to wash your hands. Next, assemble your supplies. Medication, gloves, cotton swabs, portion cup and tissues, moist and dry. Now check the 5 rights. Right child, right medication, right time, right dose, and right route. Double check that the label reads for ophthalmic use. Never instill anything into the eyes unless this is stated on the container. Now put on gloves. Put a small amount of the cream or ointment on a cotton swab by gently laying the medication on it. Gently cleanse the right eye with moist tissue, wiping once from the inner corner outward. Gently pull down the lower eyelid until the red lining is exposed and a small pocket is visible. Squeeze the drops or roll the ointment off the cotton swab into the pocket. Do not touch the container of the eye if instilling drops. To remove gloves, place all trash in one hand. Take the other hand and remove the glove by pulling it over the items. Then make sure the other hand is holding the glove with the trash and remove the glove by pulling it over. Throw in the trash. Thank the child for helping. Record the medication on the medication administration log and return the medication to storage. Wash your hands before you leave. The first step in administering medication by inhaler is to wash your hands. Then assemble your supplies. Medication, gloves, spacer or aero chamber, and mask. Next, check the 5 rights. Right child, right medication, right time, right dose, and right route. This is also a good time to look at the counter on the inhaler. Remove the cap from the inhaler and gently shake the can. Visually check the aero chamber with mask for foreign objects. Insert inhaler mouthpiece into the opening of the aero chamber with mask. Next, put on your gloves. Gently cover the child's nose and mouth with mask to seal. Spray 1 puff from the inhaler into the aero chamber. Keep mask on face for 6 breaths. Repeat if more than one puff is ordered. Verify that the counter has increased or decreased. To remove gloves, place all trash in one hand. Take the other hand and remove the glove by pulling it over the items. Then make sure that the other hand is holding the glove with the trash and remove that glove by pulling it over. Throw in the trash. Record the medication that you gave on the medication administration log as well as the counter number. Return the medication to storage. Wash your hands before you leave.